Hey friends, welcome. Today we're diving into the NMC UK Midwifery CBT MCQs to help you ace that exam and get one step closer to your dream career. Do not forget to like the video and subscribe to the channel. MCQ number 1. A woman calls you with a headache and a BP of 160/100. What is your action? Reassure her. Tell her to come to the labor ward as soon as possible. Tell her to retake the BP after 1 hour. Reassure her and tell her to go to her GP. Administer antihypertensive medication immediately. Correct answer is reassure her. Tell her to come to the labor ward as soon as possible. Explanation: high blood pressure in pregnancy can indicate preeclampsia, so prompt evaluation is necessary. MCQ number 2. What should the midwife be conscious of when doing an artificial rupture of membrane? Cord presentation and cord prolapse. Fetal heart rate. Infection. Maternal blood pressure. Correct answer is cord presentation and cord prolapse. Explanation: cord prolapse can lead to fetal distress, making it a critical concern during membrane rupture. MCQ number 3. According to Midwife, which of the following is correct about mental health and pregnancy? Mental health issues are declining. More women are diagnosed with bipolar depression. Older women from Black ethnic groups are more affected. Mental health issues are not a concern in pregnancy. Correct answer is older women from Black ethnic groups are more affected. Explanation: studies indicate higher mental health challenges among older women from certain ethnic groups. MCQ number 4. Who is more likely to have a mental health problem postnatally? A woman who has anxiety disorders such as bulimia and anorexia nervosa. A woman who experienced a stressful pregnancy. A first-time mother. A woman with a family history of mental illness. Correct answer is a woman who has anxiety disorders such as bulimia and anorexia nervosa. Explanation: pre-existing anxiety disorders increase the risk of postnatal mental health issues. MCQ number 5. What is the most common presentation seen in most pregnancies? Vertex. Transverse. Breech. Oblique. Correct answer is vertex. Explanation: the vertex, head down, position is the most common and optimal for vaginal delivery. MCQ number 6. When a midwife conducts a vaginal examination, what does she feel? The descent. Cervical dilation. Fetal heart rate. Amniotic fluid level. Correct answer is the descent. Explanation: the descent of the fetus helps assess the progress of labor. MCQ number 7. A primip in labor with fresh frank bleeding per vagina. Cause? Cervical polyps.
Vasa previa.
Fibroid. Placenta previa. Correct answer is vasa previa. Explanation: vasa previa is a condition where fetal blood vessels cross the cervix, leading to bleeding during labor. MCQ number 8. A bean-shaped pelvis? Gynecoid. Anthropoid. Android. Platypeloid. Correct answer is anthropoid. Explanation: the anthropoid pelvis is oval-shaped, resembling a bean, and is more conducive to vaginal birth. MCQ number 9. A woman is prescribed 375 milligrams of amoxil. Calculate the whole dose for 24 hours. 1,125 milligrams. 112 milligrams. 1,500 milligrams. 750 milligrams. Correct answer is 1,125 milligrams. Explanation: the dose is calculated by multiplying 375 milligrams by 3 doses per day. MCQ number 10. A woman is prescribed 200 milligrams of a drug, and it comes in 50 milligrams in 0.5 milliliters. How many mls will you give her? 2.0 milliliters. 0.2 milliliters. 4.0 milliliters. 1 milliliter. Correct answer is 2.0 milliliters. Explanation: to administer 200 milligrams, 2.0 milliliters of the solution is needed. MCQ number 11. A woman is prescribed 200 milligrams of a drug, and it comes in 1 gm and 10 mls. How many mls will you give her? 2.5 milliliters. 2.0 milliliters. 1.5 milliliters. 1 milliliter. Correct answer is 2.0 milliliters. Explanation. 2.0 milliliters provides the correct 200 milligrams dosage from the 1 gm in 10 milliliters concentration. MCQ number 12. In the first trimester of normal pregnancy, which of the following folic acid doses is administered? 0.4 micrograms, 4 milligrams, 0.4 milligrams, 400 micrograms. Correct answer is 0.4 milligrams. Explanation. 0.4 milligrams, 400 micrograms of folic acid is recommended to prevent neural tube defects. MCQ number 13. Which of the following is administered in early pregnancy? Vitamin K, vitamin A, iron, folic acid. Correct answer is folic acid. Explanation. Folic acid is essential to prevent neural tube defects during early pregnancy. MCQ number 14. About GBS in pregnant women, which is correct? GBS is routinely screened in the UK. GBS is a huge public health concern. GBS is a major cause of sepsis in newborns. GBS infection can be prevented with antibiotics during labor. Correct answer is GBS is a major cause of sepsis in newborns. Explanation. GBS is indeed a major cause of sepsis, as well as pneumonia and meningitis in newborns. MCQ number 15. A woman who is 25 weeks pregnant recently tells you she has been exposed to the varicella-zoster virus. What is your action? Tell her that she is fine and no need to worry. Tell her to report to the labor ward when she has a rash. Administer a varicella immunoglobulin dose. Tell her serious complications to her child only occur when she is exposed in the first trimester and has a rash. Correct answer is administer a varicella immunoglobulin dose. Explanation. Immunoglobulin can reduce the risk of congenital varicella syndrome. MCQ number 16. A woman of 16 years is going for a cesarean section. Who will give consent? The woman should give consent provided she is mentally competent. Her parents because she still lives with them. The hospital's legal team. The midwife on duty. Correct answer is the woman should give consent provided she is mentally competent. Explanation. A mentally competent minor can give medical consent. MCQ number 17. What are the ethical rights for decision-making? Choice and consent. Confidentiality and autonomy. Beneficence and non-maleficence. Justice and fairness. Correct answer is choice and consent. Explanation. These rights ensure that patients make informed decisions about their care. MCQ number 18. What are the major vessels in fetal circulation? Ductus arteriosus, ductus venosus, umbilical artery, umbilical vein. Pulmonary artery, aorta, umbilical artery, umbilical vein. Inferior vena cava, superior vena cava, aorta, pulmonary vein. Pulmonary vein, ductus venosus, ductus arteriosus, aorta. Correct answer is ductus arteriosus, ductus venosus, umbilical artery, umbilical vein. Explanation. These vessels are crucial in the oxygenation and circulation of blood in the fetus. MCQ number 19. About the respiratory system in utero. Respiration is an abnormal phenomenon. Amniotic fluid is required in the lungs for proper function. The lungs are fully functional before birth. The fetus breathes through the umbilical cord. Correct answer is amniotic fluid is required in the lungs for proper function. Explanation. Amniotic fluid helps in lung development by providing the necessary pressure and movement. MCQ number 20. Position for resuscitation of the newborn is neutral, transverse, supine, prone. Correct answer is neutral. Explanation. The neutral position ensures an open airway during resuscitation. MCQ number 21. A child is transferred to a pre-warmed resuscitator with 34B/M, and there is no visible rise and fall of the chest. What will you do? Ventilation breaths up to 30 cycles per minute. Cardiac compression and ventilation. Reposition the child. Give ventilation up to 30 C/M and reassess after 30 seconds. Administer epinephrine immediately. Correct answer is Reposition the child. Give ventilation up to 30 C/M and reassess after 30 seconds. Explanation. Repositioning ensures the airway is open, and reassessment is vital to check for improvements. MCQ number 22. About an obstetric emergency. Correspondence should be entered correctly, and it is okay to complete an obstetric emergency form. Documentation is not a priority during emergencies. Only verbal communication is necessary. Forms can be completed later by anyone available. Correct answer is, correspondence should be entered correctly, and it is okay to complete an obstetric emergency form. A woman gets pethidine from her local pharmacy for pain control during childbirth. It was not used. How should it be disposed? The woman should take it to her local GP for disposal. The midwife should return it back. It can be flushed down the toilet. It should be kept for future use. Correct answer is, the woman should take it to her local GP for disposal. Explanation. Controlled substances must be disposed of properly through a healthcare provider to prevent misuse. MCQ number 24. What advice will you give about SIDS? The baby should sleep in their room from 6 weeks. The baby should be placed in the cot with the foot towards the end. The baby should be tightly snugged in a blanket. The baby should sleep on their stomach. Correct answer is, the baby should be placed in the cot with the foot towards the end. Explanation. This position prevents the baby from slipping under blankets, reducing the risk of SIDS. MCQ number 25. How will you address two women, with one being pregnant, in a non-judgmental manner? Husband and wife. Birth partners. Mother and companion. Guardian and expectant mother. Correct answer is, birth partners. Explanation. This term is inclusive and non-judgmental, respecting the roles of both individuals. MCQ number 26. Which is likely to create a positive experience for the woman during birth? The presence of the partner. The absence of medical intervention. A quiet environment. A birth plan that is followed strictly. Correct answer is, the presence of the partner. Explanation. Partner support can enhance the emotional well-being of the woman during birth. MCQ number 27. What is the role of the consultant midwife? To oversee the activities of other midwives and ensure the normal childbirth pathway. To manage high-risk pregnancies only. To provide direct care during labor. To administer medication. Correct answer is, to oversee the activities of other midwives and ensure the normal childbirth pathway. Explanation. Consultant midwives provide leadership and ensure that care standards are met. MCQ number 28. How many hours for revalidation? 700 hours in 3 years. 450 hours in 3 years. 600 hours in 2 years. 500 hours in 1 year. Correct answer is 450 hours in 3 years. Explanation. Nurses and midwives must complete 450 hours of practice in 3 years to maintain their registration. MCQ number 29. A midwife tells you she has made a drug error. What is your action? Inform the prescriber, both inform the woman, and report the error as per local policies. Inform the woman, ban the midwife from drug administration for 4 weeks. Inform her that errors occur, allow her to reflect on the error and report her to NMC. Ignore the error as it was not serious. Correct answer is, inform the prescriber, both inform the woman, and report the error as per local policies. Explanation. Transparency and following protocols are crucial in managing medication errors. MCQ number 30. A woman reports to the labor ward for a planned IOL and refuses the procedure. Inform her to consider her baby. Respect her wishes and discharge her home. Persuade her to proceed with the IOL. Seek a second opinion from another healthcare provider. Correct answer is, respect her wishes and discharge her home. Explanation. The woman has the right to make informed decisions about her care, including the refusal of procedures. MCQ number 31. Where is prolactin produced? Anterior pituitary, posterior pituitary, hypothalamus, thyroid gland. Correct answer is anterior pituitary. Explanation. Prolactin, the hormone responsible for milk production, is produced by the anterior pituitary gland. MCQ number 32. What is the next stage following menstruation? Ovulation, secretory, proliferative, luteal. Correct answer is proliferative. Explanation. The proliferative phase follows menstruation, during which the endometrium thickens in preparation for potential pregnancy. MCQ number 33. A woman decides to have a home birth despite breech presentation. Support her decision, have a detailed plan of care, and inform a senior midwife for support. Advise against it and insist on a hospital birth. Refuse to support the plan. Suggest scheduling a cesarean section. Correct answer is support her decision, have a detailed plan of care, and inform a senior midwife for support. Explanation. The woman's autonomy should be respected, with a clear plan and support in place, especially with breech presentations. MCQ number 34. A woman in established labor, during a vaginal examination, you can feel caput succedaneum and the head is still high up. What is the likely cause? Normal progression of labor, obstruction, preterm labor, cephalopelvic disproportion. Correct answer is obstruction. Explanation. Caput succedaneum with the head still high may indicate an obstructed labor, which requires careful monitoring and potential intervention. MCQ number 35. What is cephalhematoma? Collection of fluid which does not cross the suture lines. Collection of blood under the periosteum. Collection of blood above the periosteum. Collection of fluid crossing suture lines. Correct answer is collection of blood under the periosteum. Explanation. Cephalhematoma is a collection of blood between a newborn skull and the periosteum, typically not crossing suture lines. MCQ number 41. What is the normal composition of urine? Water, sodium, and protein. Urea, creatinine, and electrolytes. Blood cells and glucose. Urea, albumin, and glucose. Correct answer is urea, creatinine, and electrolytes. Explanation. Normal urine composition includes waste products like urea and creatinine, as well as electrolytes. MCQ number 42. The woman informs you that she is abused by her partner. What is your action? Go to the home and talk to both of them. Refer her to the police. Refer her to agencies where she can get support. Do nothing and respect her privacy. Correct answer is refer her to agencies where she can get support. Explanation. It's essential to refer her to agencies that specialize in domestic abuse for appropriate support and protection. MCQ number 43. A woman confides in you that she is in an abusive relationship. Do nothing and tell her that you will keep the information confidential. Record it in her handheld notes. Record the information on the confidential notes entry. Inform her family without her consent. Correct answer is record the information on the confidential notes entry. Explanation. Confidentiality must be maintained, but the information should be recorded securely in a way that respects her privacy and safety. MCQ number 44. About clinical governance in the UK. What is it for? Risk management. Rostering for off days. Ensure all staff are paid the minimum wage. To manage the supply chain of medications. Correct answer is risk management. Explanation. Clinical governance involves ensuring high standards of care through risk management and continuous improvement. MCQ number 45. Cephalsuccedaneum. Fluid in the scalp under the periosteum. Fluid in the scalp above the periosteum. Collection of blood under the scalp. Collection of blood above the periosteum. Correct answer is fluid in the scalp above the periosteum. Explanation. Cephalsuccedaneum is a swelling of the scalp that occurs in newborns, and it is located above the periosteum. MCQ number 46. What position is best for shoulder dystocia? Macrobert's position, lithotomy, supine, Trendelenburg. Correct answer is Macrobert's position. Explanation. The Macrobert's position involves flexing the mother's legs tightly to her abdomen, which can help to widen the pelvis and facilitate the delivery of a baby with shoulder dystocia. MCQ number 47. According to NICE, which drug is used during IOL? syntocinon, ergometrine, oxytocin, misoprostol. Correct answer is oxytocin. Explanation. Oxytocin is commonly used during the induction of labor, IOL, to stimulate contractions. MCQ number 48. How long does it take for oxytocin to begin its effect? 3 to 7 minutes, 10 minutes, 15 to 20 minutes, 30 minutes. Correct answer is 3 to 7 minutes. Explanation. Oxytocin typically begins to take effect within 3 to 7 minutes after administration. MCQ number 49. How much does an 8-day-old baby take? 150 mgs/kg, 50-200 mg/kg, 10-50 mg/kg, 250-300 mg/kg. Correct answer is 150 mgs/kg. Explanation. The dosage for medications in newborns is often calculated based on weight, and 150 milligrams per kilogram is a common dosage range. MCQ number 50. How will you support a young girl who has no support at home to breastfeed? Skin to skin immediately after birth. Provide formula feeding. Advise her to start weaning early. Refer her to a dietitian. Correct answer is skin to skin immediately after birth. Explanation. Skin-to-skin contact immediately after birth promotes bonding and encourages the newborn to breastfeed naturally. MCQ number 51. When can you administer progestin-only pills? After 7 days. After 21 days, with no effect on lactation. After 21 days, with an effect on lactation. Immediately postpartum. Correct answer is after 21 days, with no effect on lactation. Explanation. Progestin-only pills can be started 21 days postpartum without affecting lactation. MCQ number 52. A primip at 36 weeks informs you of PROM prior to labor. Reassure her that many pregnancies usually go to birth afterward. Send her home for 1 week. Admit her for immediate induction. Send her for an immediate scan. Correct answer is reassure her that many pregnancies usually go to birth afterward. Explanation. Premature rupture of membranes, PROM, at 36 weeks is often managed expectantly, and many pregnancies proceed to labor naturally within a week. MCQ number 53. When is antepartum hemorrhage diagnosed? From 12 weeks, from 20 weeks, from 28 weeks, from 36 weeks. Correct answer is from 12 weeks. Explanation. Antepartum hemorrhage refers to bleeding from the genital tract after 12 weeks of pregnancy and before the onset of labor. MCQ number 54. How will you resuscitate a woman who is 20 weeks pregnant? Tilt the uterus to the left. No modification to the abdomen is required. Perform CPR without tilting the uterus. Elevate the legs. Correct answer is tilt the uterus to the left. Explanation. In pregnant women beyond 20 weeks, tilting the uterus to the left during resuscitation helps to avoid compression of the inferior vena cava and improves venous return. MCQ number 55. At what gestational age will you commence symphysis fundal height monitoring? 20 weeks, 24 weeks, 34 weeks, 12 weeks. Correct answer is 24 weeks. Explanation. Symphysis fundal height, SFH, measurement typically begins at around 24 weeks of gestation to monitor fetal growth. MCQ number 56. A woman with concealed abortion. Severe abdominal pain without vaginal bleeding. Severe abdominal pain with vaginal bleeding. Mild abdominal pain with light spotting. No abdominal pain but heavy bleeding. Correct answer is severe abdominal pain without vaginal bleeding. Explanation. Concealed abortion involves severe abdominal pain without external vaginal bleeding, as the blood is retained within the uterus. MCQ number 57. The effect of progesterone. It relaxes smooth muscles and leads to vasoconstriction. It relaxes smooth muscles and causes vasodilation and hem dilution. It contracts smooth muscles and increases blood pressure. It contracts smooth muscles and decreases blood pressure. Correct answer is, it relaxes smooth muscles and causes vasodilation and hem dilution. Explanation. Progesterone causes relaxation of smooth muscles, leading to vasodilation and an increase in blood volume, known as hemdilution. MCQ number 58. A young woman informs you that she wants an abortion. What will you do? Complete her booking history anyway. Tell her that she is irresponsible and should keep the baby. Refer her to the safeguarding midwife. Refuse to assist her. Correct answer is, refer her to the safeguarding midwife. Explanation. The young woman should be referred to the appropriate services, such as a safeguarding midwife, who can provide her with support and discuss her options. MCQ number 59. How will you assist a couple who had a stillbirth? Tell them how stillbirth happens. Listen to them carefully to determine their needs. Encourage them to try for another baby soon. Avoid discussing the subject. Correct answer is, listen to them carefully to determine their needs. Explanation. Active listening and emotional support are essential when helping a couple cope with the grief of a stillbirth. MCQ number 60. About data and clear reporting. The midwife is responsible for electronic and written entries, which should be signed, and avoid medical jargon. It is only required when you write on paper, and jargon is allowed. Electronic records do not need to be signed. Medical jargon can be used in both electronic and paper records. Correct answer is, the midwife is responsible for electronic and written entries, which should be signed, and avoid medical jargon. Explanation. Accurate and clear documentation, free from jargon, is crucial for effective communication and continuity of care. All records should be signed. MCQ number 61. When a woman and a midwife are working together to achieve care, what should be used? The combined strength of both the woman and the midwife equally. B. Use more of the woman's strength. C. Use more of the midwife's strength. D. Depend entirely on the midwife's strength. Correct answer. A. The combined strength of both the woman and the midwife equally. Explanation. Effective care requires collaboration, leveraging the strengths of both the woman and the midwife. MCQ number 62. When should the maintenance of health and well-being be maintained? A. Antenatal. B. Intrapartum. C. Postpartum. D. Preconception. Correct answer. D. Preconception. Explanation. Maintaining health and well-being is crucial from the preconception period to ensure a healthy pregnancy and postpartum period. MCQ number 63. If a woman says she doesn't want an episiotomy and the obstetrician attempts to perform one during a ventouse delivery, what will you do? Stop him and tell him the woman's wishes. B. Remind the woman again to see if she will change her mind. C. Let the obstetrician do it because it's for her own good. D. Inform the woman after the procedure is done. Correct answer. A. Stop him and tell him the woman's wishes. Explanation. The woman's preferences and consent should be respected and communicated clearly. MCQ number 64. A midwife can perform an artificial rupture of membranes at 23 weeks when there are signs of labor if A. On maternal request. B. A high head. C. Preterm labor. D. HIV/AIDS. Correct answer. C. Preterm labor. Explanation. Artificial rupture of membranes is typically considered in the context of preterm labor, with careful clinical evaluation. MCQ number 65. In preeclampsia, what is a warning sign? A. Diastolic blood pressure of 90 millimeters of mercury, twice taken at 30-minute intervals. B. Protein 1+ in urine. C. A single systolic reading of 160 millimeters of mercury. D. Mild swelling of the hands and feet. Correct answer. C. A single systolic reading of 160 millimeters of mercury. Explanation. Severe preeclampsia is indicated by elevated blood pressure readings, particularly a systolic reading of 160 millimeters of mercury or higher. MCQ number 66. If a woman with breech pregnancy and labor insists on delivering at home, what will you do? Respect her choices. B. Tell her the benefits and risks associated. C. Advise her to go to the hospital immediately. D. Refuse to provide any care. Correct answer. B. Tell her the benefits and risks associated. Explanation. Providing information about the benefits and risks is essential for informed decision-making and safety. MCQ number 67. A woman tells you she has epilepsy during an appointment. What will you do? A. Refer her to a consultant for review. B. Book her for normal appointments like others. C. Book her for 2 weekly appointments. D. Advise her to take her medication regularly. Correct answer. A. Refer her to a consultant for review. Explanation. Epilepsy requires specialist evaluation and management to ensure safe pregnancy and delivery. MCQ number 68. A woman tells you that her financial burdens are affecting her mental health. What will you do? A. Refer her to the mental and social service units. B. Refer her to specialist services. C. Signpost support for her and help her get financial support. D. Advise her to budget better. Correct answer. C. Signpost support for her and help her get financial support. Explanation. Providing information on available support services and financial aid can help address her immediate needs and alleviate mental health impacts. MCQ number 69. What areas does Embrace cover? A. Maternal death, infant death, and postnatal care. B. All maternal services. C. Maternal mortality only. D. Neonatal mortality only. Correct answer. A. Maternal death, infant death, and postnatal care. Explanation. Embrace focuses on comprehensive aspects of maternal and infant health, including mortality and postnatal care. MCQ number 70. What's the expected ratio of senior midwives to midwives in the ward? A. 1:4. B. 1:5. C. 1:2.
D. 1h3.
Correct answer. D. 1:3. Explanation. A ratio of 1 senior midwife to 3 midwives ensures adequate supervision and support in clinical settings. MCQ number 71. When a student midwife fails and you, as a supervisory midwife, are giving feedback, what should you do? Tell them about their errors in an interview before giving them feedback. B. Give them the feedback of their poor performance directly. C. Tell them they are dull and need to try harder. D. Avoid giving feedback and wait for their improvement. Correct answer. A. Tell them about their errors in an interview before giving them feedback. Explanation. Constructive feedback should be delivered in a supportive manner to facilitate learning and improvement. MCQ number 72. If a woman has a perineal tear, what should you do? A. Advise her that personal hygiene will help to reduce the incidence of infection. B. Give her antibiotics. C. Tell her to use warm compresses. D. Recommend frequent sitz baths. Correct answer. A. Advise her that personal hygiene will help to reduce the incidence of infection. Explanation. Proper hygiene is crucial for preventing infections in perineal tears, though additional treatments may be necessary based on clinical assessment. MCQ number 73. What stage closely follows menstruation? A. Ovulation. B. Proliferative. C. Secretory. D. Luteal. Correct answer. B. Proliferative. Explanation. The proliferative phase of the menstrual cycle follows menstruation, during which the endometrium regenerates and thickens. MCQ number 74. When a client is rushed to the hospital with intracranial hemorrhage from an RTA, what should you do? Rush to the emergency room as implied consent is given. B. Seek consent from the law court. C. Inform the police. D. Do not do anything. Correct answer. A. Rush to the emergency room as implied consent is given. Explanation. Implied consent in emergencies allows for immediate medical intervention to address urgent health issues. MCQ number 75. Where does research start? A. Selection of a topic. B. Discussion with colleagues. C. Literature review. D. Data collection. Correct answer. A. Selection of a topic. Explanation. Research begins with selecting a relevant topic or question to guide the study process. MCQ number 76. During a face presentation, what is presenting? A. Mentum. B. Face. C. Vertex. D. Brow and chin. Correct answer, B. Face. Explanation. In a face presentation, the face is the part that first engages in the pelvis during labor. MCQ number 77. What is the largest diameter of the pelvic brim? A. Anteroposterior. B. Transverse. C. Oblique. D. Diagonal. Correct answer, B. Transverse. Explanation. The transverse diameter is the widest part of the pelvic brim and plays a significant role in fetal positioning. MCQ number 78. How do you describe rhesus incompatibility? A. Baby Rh negative, mother Rh positive. B. Baby Rh positive, mother Rh negative. C. Baby Rh negative, mother Rh negative. D. Baby Rh positive, mother Rh positive. Correct answer, B. Baby Rh positive, mother Rh negative. Explanation. Rhesus incompatibility occurs when an Rh negative mother has an Rh positive baby, potentially leading to hemolytic disease. MCQ number 79. During a breech presentation, what is the presenting part? A. Head. B. Buttocks/legs. C. Shoulder. D. Face. Correct answer, B. Buttocks/legs. Explanation. In a breech presentation, the buttocks or legs are the first parts of the fetus to present during delivery. MCQ number 80. During a brow presentation, what is presenting? A. Mentum. B. Brow. C. Vertex. D. Occiput. Correct answer, B. Brow. Explanation. In a brow presentation, the brow is the part presenting through the birth canal. MCQ number 81. Does Group B streptococcus, GBS, affect UK women more? A. Yes. B. No. C. It affects Asian women more. D. It affects African women more. Correct answer, C. It affects Asian women more. Explanation. Group B streptococcus colonization varies by demographic factors, with increased prevalence noted in some populations. MCQ number 82. Which drug is contraindicated in pregnancy? A. Tetracycline. B. Anti-D immunoglobulin. C. Metformin. D. Insulin. Correct answer, A. Tetracycline. Explanation. Tetracycline is contraindicated during pregnancy due to its potential effects on fetal development. MCQ number 83. What's the minimal progress of labor? A. 1 centimeter every 4 hours. B. 2 centimeters every 4 hours. C. 3 centimeters every 4 hours. D. 4 centimeters every 4 hours. Correct answer, A. 1 centimeter every 4 hours. Explanation. Labor progress is typically measured by cervical dilation, with 1 centimeter per 4 hours considered minimal progress. MCQ number 84. Folic acid reduces the risk of what in pregnancy? A. Neural tube defects. B. Spinal bifida. C. Gestational diabetes. D. Preeclampsia. Correct answer, A. Neural tube defects. Explanation. Folic acid supplementation helps reduce the risk of neural tube defects, such as spina bifida. MCQ number 85. When you are to carry out research on the standards of care in the hospital, where do you get your data from? A. Colleagues. B. Patients, asking them about their experiences with care. C. Other research subjects. D. Past research work. Correct answer, B. Patients, asking them about their experiences with care. Explanation. Directly gathering data from patients about their care experiences provides insight into the quality of care. MCQ number 86. Before doing a vaginal examination, what kind of consent do you seek from the mother? A. Verbal. B. Written. C. Both verbal and written. D. Implied. Correct answer, C. Both verbal and written. Explanation. Seeking both verbal and written consent ensures that the patient's consent is clear and documented. MCQ number 87. A colleague tells you in confidence that she committed a drug error and asks you not to tell anyone else. What do you do? Tell her to report it to the senior midwife herself. B. Report her to the senior midwife. C. Do nothing. D. Inform the police. Correct answer. A. Tell her to report it to the senior midwife herself. Explanation. Encouraging the colleague to report the error herself ensures accountability and adherence to safety protocols. MCQ number 88. A woman came to the clinic with her 5-year-old son who looks hungry and thin. The child says he wants to eat food, but the woman quickly dismisses him, saying he eats too much. What will you do? Report this case to the safeguarding midwife immediately. B. Challenge the woman and tell her that the child is suffering from malnutrition. C. Report the case to the police. D. Advise the woman on proper nutrition for her child. Correct answer. A. Report this case to the safeguarding midwife immediately. Explanation. Reporting to safeguarding ensures the child's welfare is assessed and appropriate actions are taken. MCQ number 89. At 20 weeks of pregnancy, the fundus of the uterus can be palpated at the level of the pelvic brim. B. Symphysis pubis. C. Umbilicus. D. Diaphragm. Correct answer. C. Umbilicus. Explanation. At 20 weeks of pregnancy, the fundus of the uterus typically reaches the level of the umbilicus. MCQ number 90. At 20 weeks of pregnancy, where can the fundus of the uterus typically be palpated? Pelvic brim. B. Symphysis pubis. C. Umbilicus. D. Diaphragm. Correct answer. C. Umbilicus. Explanation. At around 20 weeks of pregnancy, the fundus of the uterus is usually at the level of the umbilicus, navel. MCQ number 91. At what speed does the blood flow to the placenta at term? A. 300 milliliters per minute. B. 600 milliliters per minute. C. 500 milliliters per minute. D. 200 milliliters per minute. Correct answer. C. 500 milliliters per minute. Explanation. At term, the placental blood flow is approximately 500 milliliters per minute, which is crucial for meeting the fetal oxygen and nutrient needs. MCQ number 92. What is normal variability? A. 525 bpm. B. 515 bpm. C. 210 bpm. D. 520 bpm. Correct answer. D. 520 bpm. Explanation. Normal variability in fetal heart rate is defined as fluctuations in the range of 5 to 20 beats per minute, reflecting a healthy autonomic nervous system. MCQ number 93. What do you need to ensure safe administration of medication? A. Right patient, right drug. B. Right patient, right drug, right dose, right route, right time. C. Right time, right patient. D. Right route, right patient, right dose, right time, right role. Correct answer. B. Right patient, right drug, right dose, right route, right time. Explanation. Ensuring the 5 rights of medication administration is essential to avoid errors and ensure patient safety. MCQ number 94. What traction should be applied to the baby's head in case of shoulder dystocia? A. Gentle, routine, axial traction. B. Forceful downward traction. C. No traction should be applied. D. Upward traction. Correct answer. A. Gentle, routine, axial traction. Explanation. In shoulder dystocia, gentle, axial traction is recommended to avoid injury to the mother and baby while attempting to resolve the situation. MCQ number 95. At booking, the woman is routinely tested for the following infectious diseases and health conditions. A. Rubella, syphilis, toxoplasmosis. B. HIV. B. HIV, hepatitis B, syphilis, sickle cell, thalassemia. C. Hepatitis B, hepatitis C, rubella, HIV, listeria. D. Rubella, syphilis, toxoplasmosis, listeria, hepatitis B, and HIV. Correct answer. B. HIV, hepatitis B, syphilis, sickle cell, thalassemia. Explanation. Routine tests at booking typically include screenings for HIV, hepatitis B, syphilis, sickle cell disease, and thalassemia. MCQ number 96. Which contraceptive pill is compatible with breastfeeding? A. None. Breastfeeding mothers should choose an alternative type of contraception. B. Progesterone pill, often called mini pill such as Cerazette. C. Combined contraceptive pill. D. Any contraceptive pill is compatible with breastfeeding, as only an insignificant amount goes to the breast milk. Correct answer. B. Progesterone pill, often called mini pill such as Cerazette. Explanation. The progesterone-only pill is considered safe for breastfeeding mothers as it does not affect milk supply. MCQ number 97. What is a common neonatal complication due to planned cesarean birth? A. Accidental cut during the surgery. B. Transient tachypnea of newborn. C. Meconium aspiration syndrome. D. Respiratory distress. Correct answer. B. Transient tachypnea of newborn. Explanation. Transient tachypnea of the newborn, TTN, is a common complication associated with planned cesarean deliveries. MCQ number 98. What are the 4 domains of the code? Prioritize people, practice effectively, preserve safety, promote professionalism and trust. B. Prioritize people, communicate well, prioritize maternal health, promote well-being. C. Promote normality, practice effectively, prioritize clients' well-being, promote safety. D. Prioritize people, document thoroughly, maintain safety, improve your skills. Correct answer. A. Prioritize people, practice effectively, preserve safety, promote professionalism and trust. Explanation. These 4 domains outline the core principles of the Midwifery Code of Conduct, focusing on effective and safe care. MCQ number 99. What pain relief is accessible at a birth setting? A. Pethidine. B. Gas and air, Entonox. C. Epidural anesthesia. D. Aromatherapy. Correct answer. B. Gas and air, Entonox. Explanation. Gas and air, Entonox, is commonly available in birth settings for pain relief, whereas pethidine and epidural anesthesia may not be universally available. MCQ number 100. What is the minimal progress of labor? A. 1 centimeter every hour. B. 4 centimeters every 2 hours. C. 4 centimeters every 4 hours. D. 2 centimeters every 4 hours. Correct answer. D. 2 centimeters every 4 hours. Explanation. The generally accepted rate of cervical dilation during active labor is 2 centimeters every 4 hours. MCQ number 101. What is variability? A. Bit-to-bit variation in the fetal heartbeat. B. Deceleration and acceleration. C. Transient decrease of the fetal heart rate. D. Increase of fetal heart rate for over 15 BPM lasting over 30 minutes. Correct answer. A. Bit-to-bit variation in the fetal heartbeat. Explanation. Variability refers to the fluctuations in the fetal heart rate from beat to beat, indicating a healthy autonomic nervous system. MCQ number 102. What screening ultrasound scans, USS, are recommended by the Department of Health? A. 2 USS at 12 and 20 weeks. B. 3 USS at 12, 20, and 36 weeks. C. There is no exact guidance. It depends on individual clinicians' discretion. D. 4 USS at 6 weeks, 12 weeks, 20 weeks, and 36 weeks. Correct answer. A. 2 USS at 12 and 20 weeks. Explanation. The Department of Health typically recommends 2 routine ultrasound scans during pregnancy, one at 12 weeks and another at 20 weeks. MCQ number 103. What does the acronym CHIN stand for in breastfeeding education? A. Close, head free, in line, nose to nipple. B. Caring, head free, irresistible, nipple available. C. Close, head supported, in line, nose to nipple. D. Clean, head supported, in line, nose to areola. Correct answer. C. Close, head supported, in line, nose to nipple. Explanation. Chin is a mnemonic for positioning the baby for effective breastfeeding, emphasizing closeness and alignment. MCQ number 104. Layla is G2P1, 36 weeks pregnant. Today at the clinic, she is discussing her birth preferences. She is young and healthy and has had an uneventful pregnancy this time around. However, during her first pregnancy, she had a forceps delivery and a third-degree tear. Layla requests a cesarean birth. What would be your action? Inform Layla that she is not allowed to have a cesarean birth because there are no clinical indications for it. B. Refer Layla for an urgent consultant appointment to discuss the mode of delivery, as this should have been discussed earlier in pregnancy by the obstetric team. Book an appointment for another birth preference discussion after the consultant appointment. C. Tell Layla that vaginal birth is better for her baby, so she is a bad mother if she wants a cesarean birth. D. Inform Layla that she should have another vaginal birth, but with an episiotomy to prevent another tear. Correct answer. B. Refer Layla for an urgent consultant appointment to discuss the mode of delivery, as this should have been discussed earlier in pregnancy by the obstetric team. Book an appointment for another birth preference discussion after the consultant appointment. Explanation. Referral to a consultant is appropriate for discussing her request and ensuring all clinical factors are considered. MCQ number 105. Amy has had some rest with pethidine, but her contractions are getting stronger. You start routine monitoring and observe short decelerations at every contraction. What do you do? A. Request an urgent senior review. Change position, cannulate, commence 4 fluids once prescribed. Consider removing pethidine. B. Request an urgent senior review. Wait for the obstetric registrar to come and tell you what to do. C. Continue monitoring and keep changing position until CTG improves. Request a review if CTG does not improve in the next hour. D. Discontinue CTG monitoring, suggest oral hydration, and recommend CTG in 1 or 2 hours. Correct answer. A. Request an urgent senior review. Change position, cannulate, commence 4 fluids once prescribed. Consider removing pethidine. Explanation. Observing decelerations requires a senior review and interventions like position changes and 4 fluids to address potential complications. MCQ number 106. When is newborn blood spot screening performed? A. Within 48 hours from birth, prior to discharge from the hospital. B. On day 3 post-birth, at the hospital prior to discharge, or at GP surgery if the baby has already been discharged home. C. At birth, in the first 24 hours of life. D. On day 5 post-delivery, when most babies are already discharged home. Newborn spot blood test is usually performed by a community midwife during a 5-day home visit. Correct answer. B. On day 3 post-birth, at the hospital prior to discharge, or at GP surgery if the baby has already been discharged home. Explanation. Newborn blood spot screening is typically done between 48 and 72 hours after birth to detect metabolic disorders early. MCQ number 107. What medicine cannot a student midwife administer under midwifery exemptions, even when closely supervised by the mentor? A. Ibuprofen. B. Pethidine. C. Lactulose. D. Anti-D. Correct answer. D. Anti-D. Explanation. Anti-D immunoglobulin administration is generally restricted due to its specific indications and the need for specialized knowledge. MCQ number 108. Which one of these emergencies is not followed by a sudden drop in fetal heartbeat? A. Cord prolapse. B. Placental abruption. C. Maternal sepsis. D. Uterine rupture. Correct answer. C. Maternal sepsis. Explanation. Maternal sepsis typically does not cause a sudden drop in fetal heart rate compared to the other listed emergencies. MCQ number 109. You work in a community. Your next-door neighbor is 9 months pregnant and was admitted to the hospital overnight. You are very curious and would like to know if she has had a baby. A. You have access to the local hospital database, so you look up your neighbor to see if she has already delivered. B. When visiting the delivery suite to top up your community supplies, You check on the board to see if your neighbor is admitted and if she has delivered. C. Make a cake and visit your neighbor to see if they need any help and if there is any news on the baby. D. You ask your friend who works in the delivery suite if your neighbor hasn't delivered yet. Correct answer. C. Make a cake and visit your neighbor to see if they need any help and if there is any news on the baby. Explanation. Visiting to offer help is an appropriate and respectful way to inquire about the situation without breaching confidentiality. MCQ number 110. What is the most common complication from epidural anesthesia that can be resolved with 4 fluids? A. Low blood pressure. B. Incontinence. C. Insomnia. D. Fluid retention. Correct answer. A. Low blood pressure. Explanation. Low blood pressure is a common complication of epidural anesthesia and can often be managed with 4 fluids. MCQ number 111. What is the difference between the first Rubin maneuver and the second Rubin maneuver in the management of shoulder dystocia? A. The second Rubin maneuver is faster and easier to perform. B. The first Rubin maneuver is external, and the second Rubin maneuver is internal. C. The first Rubin maneuver is more effective. The second Rubin maneuver is designed to push the baby's head back to the birth canal for a cesarean section. Correct answer. B. The first Rubin maneuver is external, and the second Rubin maneuver is internal. Explanation. The first Rubin maneuver involves external manipulation, while the second Rubin maneuver involves internal rotation techniques. MCQ number 112. How does hemodilution in late pregnancy affect maternal iron levels? Iron levels in late pregnancy are higher than before pregnancy. B. Iron levels in late pregnancy are relatively low despite increased iron absorption. Normal levels of hemoglobin in the second and third trimester are 105 g/L and above. Iron levels in pregnancy decrease due to hemodilution. The midwife should carefully monitor the level of hemoglobin to ensure it does not fall below 120 g/L. C. Due to hemodilution, all women in late pregnancy are chronically anemic. Therefore, all expectant women should receive iron supplements from 28 weeks of pregnancy. Correct answer. B. Iron levels in late pregnancy are relatively low despite increased iron absorption. Normal levels of hemoglobin in the second and third trimester are 105 g/L and above. Iron levels in pregnancy decrease due to hemodilution. The midwife should carefully monitor the level of hemoglobin to ensure it does not fall below 120 g/L. Explanation. Hemodilution can lower iron levels, and monitoring is necessary to ensure adequate maternal and fetal health. MCQ number 113. You made a mistake in your documentation. What do? Tear out a page from the notes and rewrite the whole document. B. Use a correction fluid pen to correct your mistake and keep your notes tidy. C. Draw a single line through the original record to ensure it is visible and ensure your new entry is signed, timed, and dated. Cross out the original entry, ensure it is not visible and does not confuse the reader. Correct answer. C. Draw a single line through the original record to ensure it is visible and ensure your new entry is signed, timed, and dated. Explanation. The correct procedure involves clearly marking the error and documenting the correction properly. MCQ number 114. You are looking after Amy, who is G1P0, 38 weeks pregnant, and undergoing induction of labor for IUGR. She has had a purpose. What do you do next? MCQ number 115. What is the PDSA cycle used for? A. Plan, do, study, act. B. Plan, do, share, analyze. C. Plan, develop, study, assess. D. Prepare, do, solve, act. Correct answer. A. Plan, do, study, act. Explanation. The PDSA cycle is a quality improvement framework used to test changes and improve processes. MCQ number 116. What is sustainable healthcare? A. Standard care that minimizes ecological wastage. B. Standard care that lasts for a long period of time. C. Care that ensures all patients receive equal access to services. D. Care that is continuously updated with the latest research. Correct answer. A. Standard care that minimizes ecological wastage. Explanation. Sustainable healthcare focuses on reducing environmental impact while maintaining effective care. MCQ number 117. Where to record symphysiofundal height? A. Specialized record book. B. Partograph. C. A column in the antenatal card. Correct answer. C. A column in the antenatal card. Explanation. Symphysiofundal height is typically recorded in the antenatal card as part of routine monitoring. MCQ number 118. Which screening test is done for anxiety in pregnancy? MCQ number 119. What is active listening? A. Encouraging the speaker to keep speaking. B. Closely watching the body language of the speaker. C. Giving the speaker enough time to speak freely and without interruption. D. Reflecting back what the speaker has said. Correct answer. C. Giving the speaker enough time to speak freely and without interruption. Explanation. Active listening involves fully concentrating on and understanding the speaker's message without interruptions. MCQ number 120. Factors that affect safe and effective care. A. Avoid all harm to the patient. B. Avoid preventable harm. C. Ensure all medical procedures are performed correctly. D. Continuously update knowledge and skills. Correct answer. B. Avoid preventable harm. Explanation. Ensuring safe and effective care involves minimizing preventable harm through proper procedures and protocols. That's all for today. I hope these UK CBT midwifery MCQs and tips have given you the confidence to tackle your exam. If you enjoyed this video, make sure to give it a like. And if you haven't already, hit that subscribe button and ring the bell so you stay updated with all our future content.